Hello everyone, my name is Justina Aweze, a psychiatric mental health MP student at Brandman University. I'm here to present my interrogative therapy video. The client I'm working with today is Miss Edna. Miss Edna is a 36-year-old Nigerian lady who was brought to the United States of America by her husband 8 years ago. She was a registered nurse in Nigeria before coming to join her husband here in the United States. She worked so hard to pass her nursing board exam here and started working as a registered nurse in the United States too. She presented to the clinic today for a follow-up visit for a strained relationship with her husband. She has had low self-esteem and anger. She has no significant medical history, no surgical history, no psychiatric history. She's not on any medication. She has no drug or food allergies. She does not smoke. She does not use any illicit drug. I've been working with Miss Edna for the past 6 weeks now, so she's here for a follow-up visit. As I said earlier, Miss Edna was brought to the United States by her husband, Mr. Chris, who do not treat her like a wife, but rather as a house help or as a maid. He had forced her to work 2 jobs, and all her incomes are managed by the husband. She has 2 young children, ages 8 and 6, who have started going to school, and she wants to be involved in her children's life and their schoolwork. But because she worked 2 jobs and always exhausted, she could not be involved in her children's life as she wanted to be. Her husband has been verbally abusive. He will not let her socialize with her friends. He called her names like lazy, ugly, good for nothing. Her husband even started bringing in a girlfriend to their matrimonial home when she's at work. Her husband's behavior has started affecting her negatively at workplace. She used to be an incredible detailed nurse, but recently, she is lacking at her job. She is always missing her patient's orders. She started having poor concentration at work and even poor time management. One day, her boss called her in the office. She confided in her boss what has been going on through her marriage. Her boss was the one that suggested she seek help through therapy. She has tried to resolve issue with her husband to no avail. Whenever she brings up issue about the way her husband is treating her, her husband always interrupts her, telling her she has nothing reasonable to say. She loves her husband and children and does not want to leave her marriage. So during my encounter with Miss Edna, I'll be using 3 individual therapy and role play to work with her. In session 1, I will be using the empty chair technique, which is also known as the geyser therapy. The empty chair technique is a talk therapy exercise in which the client will express their thoughts and feelings as if they were talking to a specific person, even though that the person is not present. The client will direct their word and gesture at the empty chair and imagine that the person sitting in the empty chair is who they are talking with. This empty chair therapy was developed by Fritz Perls. The geyser therapy has been widely used by therapists since its inception in 1940. This therapy is appropriate for Miss Edna because it will allow her to express her feelings freely without interruption. This free expression can relieve her burden dramatically, allowing her to move through her past pain. The empty chair technique focuses on here and now. Through this therapy, people have learned to discover feelings that may have been suppressed or masked by other feelings and to accept and trust their emotion. Needs and emotions are previously suppressed or acknowledged are likely to surface as well. Through this empty chair technique, the person or the client will gain a new sense of self-awareness. The empty chair technique can help clients work on the way they communicate also. As they practice, they will develop a new communication skill. A communication skill that will be more readily and accurately enable them to express their feelings and thinking. Then in section 2, I will be using the person-centered or client-centered therapy. This therapy uses a humanistic approach and was developed by Carl Rogers. With the use of the person-centered therapy, I will be genuine with my client, Ms. Edna. I will provide her with unconditional positive regard, and I will show her empathic understanding to her feelings and her problem. I will show her respect, and I will be non-judgmental to her feeling. This person-centered therapy will help my client feel accepted, irrespective of her feelings and thoughts. But the downside of this therapy is that some clients, due to their cultural upbringing or cultural background, may find it difficult to discuss their personal or family issue with a stranger, and this may be a barrier. If the client did not disclose all her problem to the therapist will not see the full picture of what is going on with the client, and also will not assist the clients as supposed to be. The person-centered therapy is appropriate for Ms. Edna because it will allow her to improve in her self-concept, will also improve her self-esteem, and also help her organize her set of belief and idea about herself. Self-concept play an important role in determining not only how people see themselves, but also how they view and interact with the world around them. Then in the third section, I'll be using the cognitive behavior therapy, otherwise known as CBT, which was developed by Aaron Beck. Cognitive behavior therapy is a form of psychological treatment that has been demonstrated to be effective for a range of problems, including depression, anxiety disorder, alcohol, drug use problem, marital problem, eating problems, and severe mental illness. Numerous researches have suggested that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as and even more effective than other forms of psychological therapy or psychiatric medication. CBT places emphasis on helping individuals learn to be their own therapist. CBT is based on the belief that the way individual thinks affects their feelings and also affects their behavior or action. CBT identifies distorted feelings and emotion and replaces them into positive thoughts, feeling, and emotion. Through exercises in this section, as well as homework exercises outside of session, the patient or the client will be helped to develop a coping skill whereby they can learn to change their own thinking, problematic emotion, and behavior. CBT helps to boost happiness in individual. CBT will help Ms. Edna to see herself in another perspective and not her husband's perception of her. The reason why I choose three therapy instead of 1 or 2 therapy in helping Ms. Edna is that research has shown that combination of therapies are more effective in alleviating psychological problems and improve outcome, and they work faster than when only one therapy is used. So today I'll be talking to Ms. Edna. Hi, good afternoon, Ms. Edna. How are you doing today?
Good.
I'm Justina Arize, and I'll be working with you again. I'll be working again with you today. Please, before we go further, I want to let you know that this video will be this conversation will be videotaped. Only your voice will be heard. You will not be seen. So I just want to obtain your consent for this conversation to be videotaped.
I give you my consent.
Good, thank you so much. So, Miss Edna, what has been going on for the past 2 weeks?
The past 2 weeks has really been very challenging. I got to find out from my older child that my husband bring in a lady into our matrimonial home whenever I'm at work. I tried to confront him, and as usual, he will not let me speak. He calls me fool, stupid, ugly, good for nothing. That he brought me from a poverty stricken home to America, and I should be grateful for that. His behavior towards me is getting unbearable by day. I love him and I want to make things work between us.
Oh, I can understand how you feel. Yes, you say that your husband usually calls you all kinds of names and he will not let you speak. He will not even let you talk to him. When you try to resolve issue with him, he always interrupts you. So today I'll be working with you using a technique called the empty share technique. This empty share technique is like you're going to be speaking to an empty chair, but you just pretend as if Chris, your husband, is sitting on that chair. So I want you to speak to this chair and tell this chair, pretending that this chair is Chris. Tell Chris everything you want to say to him.
Chris, you know I love you. You brought me to the US as a wife, not as a maid or a house help. All I ask is that you respect me, love me, treat me as a wife and not your property. You have even gone to the extent of cheating on me while I'm at work and providing for you and your kids. The way you treat me is really affecting my job performance at my workplace. All I want is for you to change your attitude towards me. I really want us to be one happy family.
Good. Thank you. How did you feel when you are talking to Chris?
Initially, I feel a lot of stress, anger rising up within me, and then I feel a form of relief coming into my soul.
Good, good. That's how the empty share techniques works. Initially, you will feel that suppressed anger rising up. And since you are uninterrupted, after you pour out your heart, you will start to feel the relief. So I want you to practice this empty share technique at home. Whenever you feel overwhelmed with emotion, just get an empty share, talk to that empty share like you're speaking to Chris, and you will see with time you will start to feel relief of all this suppressed anger and suppressed emotion. Can you be able to do this at home?
Yes.
Good. Please, you have my card. I want you to call me anytime you feel like you need help. I'm here to support you and help you all the way to see that you feel better. Okay, Miss Edna.
Okay.
I will see you again in the next 2 weeks.
Okay. Thank you.
Yes. Hi, Miss Edna. How are you doing today?
I am still feeling horrible.
Oh, I understand you have some concern that you want to discuss with me today. Can I hear your concern, please?
I know I came here due to recommendation from my boss to see a therapist. I really feel uncomfortable talking about my family issue with strangers due to my cultural background. A woman must not involve a third party in her matrimonial home or matrimonial issues. That was why I have tried to solve this issue on my own for a long time. But since it's not getting resolved and I'm not able to resolve it, that's why I seek for help.
Yes, I understand how you feel. I know that every one of us have, some cultural belief that we adhere to, and I respect that. And I respect you for coming to seek help from a therapist. Sometimes we will try to solve things on our own and it may not work. So today I'll be working with you on with a technique called the person-centered therapy. This person-centered therapy is just to show you an unconditional love, and I will show you I will be empathetic, I will be listening to you, show you respect. I will not be judgmental. With your caution, I know that with your caution, you don't want to, bring your marital issue to a stranger. But now you already know me, and I respect your view, I respect everything about you. I'm not going to judge you. I just want you to feel regarded. I don't want you to feel the way you feel with Chris. With me, I want you to feel that you are important. That's why I want to show you that unconditional positive regard, and I want to let you know that your feelings, your emotions are recognized. And I know that as you work with me, you're going to feel more relieved of all those emotions. So I would just want you to continue to do the empty share technique again. And also, you call me whenever you need any help. I'm always here to help you. So can you tell me, with all this you've talked about, is there any other thing that has been going on at home with you for the past 2 weeks that you still want to talk to me about?
Yes, my husband yells at me for no reason, still calls me ugly, good for nothing, lazy. I am very concerned because he does this in front of our kids, even my visitors, friends, and I know this behavior is also affecting my kids.
Oh, I'm so sorry about this. I want to summarize what you just said. You said that your husband still calls you ugly, good for nothing, and he calls you all this even in front of your kids, even in front of strangers. I am really sorry about this, and I want to let you know that as we work together, you're going to start feeling you're going to start feeling better. You're going to, be respected by me, and with this person-centered therapy that I'm talking about, you will see that uh, your your emotion will start to change. So please don't forget to call me whenever you need help. This is you still have my card, right?
Yes,
Please call me. I'm here to help you with anything. Okay? Do you have any question for me?
No, thank
So,
you.
yes, so I will see you in the next 2 weeks.
Thanks.
Yeah. Hi, Miss Edna. How are you doing today?
I am about the same. I am really feeling down, unhappy, unloved, worthless, good for nothing.
Oh, why do you think you feel this way?
My husband continues to call me all these names, and I'm starting to believe that I am the way my husband calls me.
Oh, I can imagine how you feel. Yes, sometimes every one of us has certain amount of stress, and we must deal with difficult situations like this sometimes in our lives. But I want to let you know that making a choice to think positively in a situation like this will help you overcome the negative feelings. Remember, how you think affects how you feel, and how you feel affects how you behave. It's called the thinking, feeling, and behaving triangle in our practice. Many times, there are trigger effects that spike up negative feelings. And I know in your case, it's because of what your husband always says to you. When your husband calls you this name and you believe him, those names will start having negative impacts on you. And this is what we call core belief in our practice. The core belief is a central belief that people hold about themselves, about others, and also about the world. But you can change this core belief by using a positive self-talk, which will generate positive emotion in you. There are a lot of positive self-talk you can talk to yourself, that will change all those emotions that has been built up because of what your husband have been saying to you. Can you give me some example of positive self-talk?
I am loved.
Good.
I am beautiful.
Yes.
I am not good for nothing.
Good.
Like he called me. I am respected.
Yes.
I am hardworking.
Amazing.
And I am an achiever and a go-getter.
Good, good, good. These are wonderful self-talk, and I want you to practice this self-talk often. In fact, I will give you an assignment or something that I will call an homework. I want you to write this positive self-talk. I am beautiful. I am hardworking. I am loved. I am respected. Write them down and put them where you can be seeing them easily every single day. Just put it where you can see it easily every single day. Say it 10 times in the morning and 10 times at night. You will see that it will start to generate positive mindset in you, and then you will see that you will start to become happier again. This technique we just did is called CBT, and it helps you stay in the moment. It helps you, it will help boost your morale. It will help boost your self-confidence in you. So can you be able to do this exercise?
Yes.
Yes, please try to do it 10 times in the morning and 10 times at night. Okay?
Okay.
Yes.
Thank you.
Okay. Is there any other thing I can help you with?
No.
Okay.
I feel relieved already.
Yes. So with all these three therapy that we did, the empty share technique, the person-centered therapy, and the CBT, how did the combination of these three therapy help you for these past 6 weeks?
It helped me. It's awesome. I feel much better.
Good, good, good. I'm really glad that you feel better. And I will see you again in the next 2 weeks so we can continue to practice our other therapy, okay?
Okay.
Please remember to call me with any problem. I'm here for you, okay?
Okay.
Thank you, Miss Edna, for your time. I really
Thank you.
appreciate your time.
Thank you.
Good.